Hi, it's Ariel. I just wanted to talk some more about temporal lobe epilepsy. It took me a long time to find out all this information about temporal lobe epilepsy, so I wanted to share it. It's the kind of epilepsy I have, and it sometimes can be hard to diagnose. I'm just going to talk some more about that. So one of the things in temporal lobe epilepsy is that it's about the most common partial epilepsy. So meaning it's the most common type of epilepsy that starts in one spot in your brain. It's also called focal epilepsy, meaning there's like a focal point, they call it, and your temporal lobes are on both sides of your brain, and there's two of them, and they're about at ear level, and the most common seizure that you have is a complex partial seizure. So this is the most common type of partial epilepsy, and then the most common type of seizure in temporal lobe epilepsy is a complex partial seizure. Basically, 75% or 3/4 of people who have temporal lobe epilepsy have simple partial seizures. And I've talked about that. You can check out my other videos on simple partial seizures. I really think it's important to understand them. And if you have temporal lobe epilepsy and you probably have simple partial seizures and you probably didn't know it, and you probably are freaked out and wondering what the heck is going on. So you should watch some of the other videos. So anyway, some people only have simple partial seizures. So you can actually have temporal lobe epilepsy and have just simple partial seizures, simple partial, complex partial, and then there's also what's called secondary generalization. And that's basically when the point, the place where your seizure starts, it then spreads to the whole brain. So that's what they call a generalized tonic-clonic seizure. Most people, a generalized seizure, it's going to be a tonic-clonic seizure. It means you stiffen and shake. And so that's a grand mal seizure. I prefer to call them tonic-clonic seizures, since that's what they're called. And anyway, I think it's important to realize that 60% of people have small seizures, partial seizures, that turn into tonic-clonic seizures. So that means that about 60% of people with temporal lobe epilepsy have grand mal seizures, as well as partial seizures. But it also means that there's 40% of people with just partial seizures and this type of epilepsy. So you can have either. And you can have one type of these seizures. There are 3 types usually, and it's the simple partial seizures, complex partial seizures, and tonic-clonic seizures. Those are the most common. I just wanted to say that the most common type of temporal lobe epilepsy is medial or mesiotemporal. So medial means closer to the midline. So basically, inner portion of your brain is where the spot is that your seizure starts. So if you have, there's also a type of temporal lobe epilepsy that's on the outer cortex of your brain, and that has a different characteristics. But the kind that's medial, so meaning deep in there, it can affect memories and emotions especially because it's near your limbic system, and that's where your memories and emotions are. So if you have a seizure in that place, it's going to cause a change or an effect on those feelings and things. So it's going to cause a seizure that changes your senses or cause an emotional reaction to, a seizure that is an emotional feeling. It's not a reaction because you're not reacting to anything, but it's an emotional, experience. That's what I would say. So, a lot of people who've had lots of seizures for more than 5 years with temporal lobe epilepsy will have memory problems. Basically, some examples of simple partial seizures that are in temporal lobe epilepsy are a rising feeling in the stomach, and someone described it like the feeling you get on a fairground ride. Deja vu, I've talked about that a lot. I have lots of deja vu, so that's one of the other most common simple partial seizures in temporal lobe epilepsy. And so if you have a deja vu experience and you have epilepsy, or you think you do, most likely you have temporal lobe epilepsy because it's very common. And the general deja vu experience for the general population, I think, is just different. I always was told, oh, I have deja vu too, and that just didn't make sense to me because mine was really strange and different. And so anyway, I'm just encouraging you to think that maybe it is a seizure if you think you have epilepsy, or you do have epilepsy and you don't know what these experiences are, they are probably seizures. Getting an unusual smell or taste, and a sudden intense feeling of fear and joy, or joy. Not necessarily fear and joy. That would be a little better. But I tend to get the deja vu, the strange, I don't get the smell or taste. I'm glad. Some people say it tastes burnt a lot of times. Really gross. And I do get the sudden fear, anxiety kind of thing. It's hard because somebody was just talking today about how they have panic attacks and epilepsy. And is that related, or is it epilepsy causing the panic attacks? I would say that there's the possibility that you have a partial seizure and it causes such an intense emotional experience that then you kind of freak out. So I think that's possible too. So I think the connection between anxiety and temporal lobe epilepsy is very, very close. So you may also have PTSD from having so many seizures, like I do, and I did a video on that. And so when you have a seizure, it also triggers all this stuff from your other seizures that you've had, and lots of anxiety. And so, it's very complex, and you have to find out about, kind of breaking it down, working with a neurologist, preferably working with a psychiatrist too, especially if you have temporal lobe epilepsy, because you will tend to have mood problems, depression, anxiety, and sometimes, and lots of other things, but a lot of psychiatric stuff is common. So simple partial seizures are also called auras, and it took me a long time to find confirmation for that because I was thinking it was, but I wasn't positive. So simple partial seizures, there's no change in consciousness. An aura is a lot of times what somebody experiences right before they have a tonic-clonic seizure. So if you understand what I was saying about the secondary generalization, basically you start having a little partial seizure, a simple partial seizure possibly, and it turns into, then a tonic-clonic seizure. So then you go unconscious and fall down and have a seizure. So you've already had one, and some people get that right before they have a tonic-clonic seizure. So like I said, 60% of people have the kind where it starts as a small seizure and spreads to your whole brain. That is important to know because you may or may not have what is called an aura. What it means is that it's a precedent to your large seizure. But sometimes people call it an aura when they mean it's like pre-complex partial seizure. So it's complicated, but the basic idea that I'm saying is that if you have a simple partial seizure, you may have what people call an aura, and then experience the losing consciousness and having a tonic-clonic seizure. So I personally don't experience the simple partial seizure and then pass out. I just pass out. So what's happening though is that there is a partial seizure happening, but I don't experience it. I'm in the same moment turning into a secondary generalization and fully passing out. So some people have it right before, some people don't. But in temporal lobe epilepsy, it's pretty common. And the nice thing about it, some people, it's a warning, and so they can stop, lie down, something like that. But basically what it is that it's because it starts in one place and spreads. So that's why you may have an experience of a simple partial seizure or aura before your tonic-clonic seizure. So, I want to talk about complex partial seizures. They are the most common type of seizure with temporal lobe epilepsy, and they're 30 to 60 seconds usually. Fixed stare, impaired consciousness, fumbling, lip smacking, things like that. Temporal lobe epilepsy is kind of hard to diagnose, and a lot of people don't know that they have this type of epilepsy. I didn't ever have anybody ask me any questions that would have spawned me realizing that what I was experiencing was a seizure. I just thought I was having psychotic episodes. Like, I just didn't know what to think. I mean, I was just at a loss for what the heck was going on. And I don't know about other people, but it's scary to tell people what's going on because you're afraid they're going to basically say you are psychotic and you need whatever, And I just didn't feel like I was psychotic. It was so sudden, it would happen out of the blue, and then I would go back to feeling normal in a couple hours, and it was like, what is going on? I couldn't feel, I didn't feel bad all the time, so it's just so confusing sometimes. And so it's just so important to realize if you have temporal lobe epilepsy that you have it so you can treat it properly. There's also different meds if you tend to have just generalized seizures, which are tonic-clonic seizures or grand mal seizures. Then there's also absence seizures, which are another type of generalized seizure. But I'm not talking about that right now. So the most common, well, I don't know which one's the most common, but anyway, the grand mal seizures, basically, the grand mal seizures are basically going to be, I totally forgot what I was saying. Anyway, when you get diagnosed, basically there is meds. And, what I was going to say is that you have to take partial epilepsy meds or generalized epilepsy meds. They are different and they work differently. Some meds work for both. However, if you just have partial seizures, or even if they start as partial seizures, which in temporal lobe epilepsy, it is starting as a partial seizure in one place. Basically, it can't be treated well with a drug that's just for tonic-clonic seizures because that is about the whole brain starting at once. So I don't know if you know, but basically with seizures, so it can start in one part of your brain, spread, and then what happens is you get your brain misfires. So if you know about, neurons and neurotransmitters, basically your brain starts misfiring in rhythm. So that's the key, because your brain just doesn't misfire. It actually goes bam, bam, bam. So in a smaller or partial seizure, you're going to get just a little bit, but in a tonic-clonic seizure, you actually see on the EEG, it actually is going like rhythmic misfiring. So I think that's good to know. Basically, most of temporal lobe epilepsy is actually diagnosed from people describing their seizures. So you do need to describe your seizures to your neurologist. So if you don't have an epileptologist and your neurologist doesn't know what you're talking about, if you tell them, hey, I might have temporal lobe epilepsy, and they're just like, well, I don't know that much about it, because, they're dealing with Alzheimer's and Parkinson's and seizures, but they might not know as much about each type of epilepsy, and then the specific, simple partial seizures that you're having from temporal lobe epilepsy. So you may need to get a neurologist that is actually a specialist in epilepsy, which is an epileptologist. So, a third of people are not helped with meds. That's a lot, that's a lot. And I personally am helped by meds, but they're not controlled fully. So I take 2 meds and, I still have partial seizures, but I don't have tonic-clonic seizures anymore. So I'm very grateful. So it means that I'm having small seizures that are not generalizing and turning into a tonic-clonic seizure. A lot of people who do not have full control over their temporal lobe epilepsy seizures will have a bad quality of life. Basically, like I said, a third of people, it's really sad that many people are having a poor quality of life based on the fact that your memory and emotions are right there where the seizure is starting. So a lot of people will have problems with memory. They'll feel nervous socializing. They'll have fear of leaving the house. I know I have that. For a long time I had a really hard time because I was so scared when I would leave the house that I would have a seizure, and then I was somewhere else and I would get confused and I would get lost. I would drive to the wrong place. I didn't know I was having them. So, or even when I wasn't driving, because then once I figured out I had epilepsy, I wasn't driving for a while, and so I was having the simple partial seizures, and I'm going, what's going on? And I couldn't think straight. And when you're out and about, it feels very scary and not safe. especially when I was living in a city at the time, when I finally figured out what they were. And before that, while I was living in the city, I'd have these experiences going out on, and I'd be like, oh my God, what's going on? And so you get really scared and you just don't want to leave the house because it's so scary and doesn't feel safe. And that's the main thing that happened for me, was that I just didn't feel safe because they weren't controlled. Once I figured out what they were, I was able to start a second medication that started controlling the simple partial seizures for me. So basically you can have, sometimes some of your seizures controlled, sometimes more, sometimes all. Basically you have intractable or refractory epilepsy, if it doesn't respond to meds well. Now, there's also just some information about risk factors, that basically most people with temporal lobe epilepsy have normal birth, labor, and delivery, and development. So it doesn't impair, your development. And most people do have a normal birth, labor, delivery, development, going along. And then, and this is interesting to me, at the end of the first or second decade in most people is when the temporal lobe epilepsy begins. So I find that interesting. I started having seizures when I was 12. So it's about, the end of the first decade. And so you can get this at any time. And most adults have partial epilepsy syndromes who are diagnosed as adults. A lot more kids, they tend to have all different types, but adults tend to have partial epilepsy. So you get into the first, second decade, you're saying early teens, early 20s. And you can also have your hormones affect temporal lobe epilepsy. They can affect any seizures. I just know for myself they are extremely connected to my hormones. So basically throughout the month I get hormones, I get seizures in clusters based on my hormones changing. So those are called catamenial seizures, and I did a video on that. As I said, simple partial seizures are auras. I gave you some examples of simple partial seizures, and also there's just the fact that in the US the prevalence of epilepsy is approximately 1% of the population. So, it's a lot of people. It's a lot of people. So you're not alone, and do look at the other videos I have on temporal lobe epilepsy and other factors, or things like epilepsy and depression, epilepsy suicide risk. It goes up, and I don't have the exact statistics on me because I looked for them, but I couldn't find them, and I can't figure out where I had them. But basically, in temporal lobe epilepsy, your risk of suicide goes up a lot higher because your risk of depression is way high. And so if you have temporal lobe epilepsy, you really need to be careful if you start getting depressed, because it's really, really important to treat it. So it's imperative. It's not just like, oh, I think I'm a little depressed. It's like, if you are really depressed, you need to realize that and do something about it, because the fact that your brain is causing depression and it's connected to your epilepsy, it's not going to get better when you keep having more seizures and it keeps firing in that spot in your brain. So basically, you're probably going to stay depressed because it's probably not just about life. It probably has something to do with your epilepsy. So if that's the case, you may need to treat it in all kinds of ways. Lifestyle changes, maybe meds, whatever you do. However, you do need to get help. So you might want to get a psychiatrist to help with if you have anxiety or depression or other psychiatric problems. It's very important to get them dealt with. And in temporal lobe epilepsy, there's also a high risk of suicide. And that's important to know, because I personally was totally had a suicidal situation. So I guess, that's good to know, because if you know that you need to treat your depression, take it seriously, and take it seriously if you feel like you have suicidal ideation, or if you really are suicidal. And there's so many good resources for getting help. And I have on my wall, I have numbers of suicide hotlines and clinics that I can call, you know, the mental health in this county, stuff like that, because I have had some real downs, and especially when I'm having lots of seizures, and especially during the seizures, when I didn't know that it was epilepsy, I would get so depressed right in the seizure and feel so down. And right then, I was especially risky for suicide. So, and if you have clusters, then that can be like all of a sudden you're having a bunch of that, you're feeling super down, and it can be dangerous. Please take care of that. And don't worry about, oh God, I have psychiatric stuff and epilepsy. It's like they go hand in hand a lot of times for a lot of people. And you have to treat both of them, and you really have to take it seriously, especially with temporal lobe epilepsy. Hope this helps.